Hello again. So I want to thank Terry Duncan for her time and effort that she put into her presentations of neurology and seizures. She did a short introduction and had 2 videos that we watched in class and live on Zoom that brought a lot of information that I hadn't heard of, which is not hard. I always say I know enough to get myself into trouble. However, post-production, I've realized that we had no sound on either one of those. So, down in the description box below, there are 2 links, one for each of the videos. Since you are watching this post-production, what I need you to do is write a summary about both of these. Just click on the link. It should bring you to the video. One's real short, one's a little bit longer. Write me 5 sentences. Not 5 sentences for each video, 5 sentences summarizing both videos. And I'll get your certificates out to you. Thanks, guys.
All right, we are on our last section for today. I'm sorry for the long delay. When I had John host a while ago on his laptop, when it ended, for some reason it didn't upload to the cloud. It wanted to upload to my hard drive. And it took forever, in 68 days. So then we had some complications with Terry's laptop. She's got some videos that she wants to present to us. But before we get started, she wants to give us an introduction into what she is presenting today. So I am handing, I don't know why I keep looking at the screen when I'm over here. So I'm going to hand it over to Terry.
Okay, today we're going to go over neurological diseases, and epilepsy. Epilepsy will be one of them. There are several different kinds of seizures, and then we're going to kind of just touch base on those, and in the videos we'll have some more detail and some really cool images of the brain that we're going to be talking about. The group of neurological diseases are characterized by reoccurring seizures. They result from a sudden surge of the brain's electrical activity. Depending on which part of the brain is affected, precipitates whether you have a loss of awareness, unusual behaviors or sensation, uncontrolled movements, and a loss of consciousness. Seizures can manifest in any of these areas. The brain's complex network of billions of neurons can be excitatory or inhibitory. And normally in the brain, you have the excitatory nerve stimulation and the inhibitory, which kind of regulates how the brain fires. When you have a seizure, you can have the excitatory neurons that fire, and they can be either in a specific part of the brain or all over. And then your inhibitory stop firing at that point, which is how you end up with all the seizure activity. Epilepsy. With seizures, you have the upregulation of the excitatory neurons when they're firing, and the inhibitory ones just don't fire. You've got limited parts of the brains caused the partial focal seizures, and then when the entire brain is involved, it's called your generalized seizures. With the partial seizures, you'll see the simple partial seizures, which can be unusual feelings, strange sensations, uncontrolled jerky movements, but the patient may be conscious and aware of their surroundings. With your complex partial seizures, there's a change in consciousness and awareness. With your generalized seizures, you have absent seizures is one of them. They occur mostly in children. They have a brief loss of awareness. They might manifest with a blank stare, with lip smacking or eye blinking, and those may go undiagnosed for years and may never get diagnosed. And some of these children, they're saying that they've been diagnosed with ADHD when it's actually this, because there's just not enough done about it, because they think maybe they're being defiant They're not listening or they're not participating, and a lot of it goes undiagnosed, being proper. Children that start having the seizures, the absent seizures early in life, a lot of times they will actually outgrow it and not require treatment. But the thing is most of them go unrecognizable. They'll say that something else, right? When you've got the tonic seizures, they're characterized with the stiffening of the muscles. It's increased muscle tone. And a lot of times when they have the tonic seizure, you will actually see, since the muscle tones are tensing up, that they may fall backwards. And that is caused from the muscles tensing up and they're losing control and they may fall backwards. With your atonic seizures, those are called drop seizures, another word for them. And that's when you have the loss of muscle tone, which may cause the patient to drop down. You know, they lose all their muscle tone, so they'll drop down. Those are called atonic seizures. And then you've got your clonic seizures, which are characterized with rhythmic jerking movements, and they commonly affect the neck, the arms, and the legs. And with those, you'll just see them all of a sudden jerking the one body part. With the myodonic seizures, well, the clonic seizures, you'll see them doing rhythmic movements of muscle jerking. And like I said, it can affect the face, neck, arms, and legs. With the myoclonic seizure, that's a jerking motion from like one body limb. It'd be like seeing somebody getting hit with a bolt of lightning. They just jerk on that one body part. And that's a myoclonic seizure. Your tonic-clonic seizures are your convulsive seizures, is what most people recognize and call a seizure. They're called tonic-clonic seizures. They're the muscle stiffening, the jerking that most people will refer to as a seizure. A lot of them will lose consciousness. They might lose their bladder control. With these type of seizures, they can last up to 5 minutes or longer. If it becomes longer, then they need to seek medical treatment immediately. We've all seen them. We've seen them last a lot longer than that. Some of the causes of seizures can be an injury, a tumor, stroke, infection, and even birth defects can cause the seizures. One of the things I ran into with a patient not that long ago is we got called out for seizure activity for, I believe she was 39. Is that right, Mike? 39-year-old female. And when we went to the house, she was sitting up talking fine, didn't appear post-ictal at all. She had a seizure with, she was actually talking to a Terminix guy who was there when she went into a full-blown seizure of the shaking and the muscle tone, loss of consciousness, bladder loss, the whole 9 yards. Well, as we're talking to the patient and the son was there, the family, come to find out this patient did not have a seizure history, okay? But the son had said that she had been falling a bunch in the last few days. Didn't really appear to have any head injuries or anything like that from the falls, but she had been falling a bunch and just doing some really odd things. Well, when we were talking to her initially, she was alert to herself, but not 100%. She couldn't remember her date of birth, which is usually something most people remember. She couldn't remember her son's last name or his birthday. So it was just a very odd presentation for this seizure. So we went ahead and loaded her up and brought her into the hospital. And after doing the CT on her head, because of what we were describing and not having a seizure history, they went ahead and CT'd her. She had a very large tumor.
About the size of my fist.
Well, come to find out, it wasn't quite that big. A lot of that was inflammation around the tumor, but she had a very large tumor, and when we seen the CT scan, it actually pushed her midline of her brain over. It was very, very interesting to see. I got a printout, but I forgot to get it to actually present it. But what we've seen, and I didn't realize that at the time, is since I don't look at enough CTs, that it looked like the tumor was the size of Mike's fist, a big fist.
Mm-hmm.
Well, later on, I was talking to the radiologist or an assistant down here, and he said that a lot of what we were seeing was the edema around the tumor that had pushed the midline over, all the swelling. So who knows how long it's been there. She had no history that would have referred to it. If this had not happened to this patient, she would have went on with this tumor being unrecognizable. But the seizure presentation and the falling and everything is what led them to go ahead and do a CT. She ended up getting flown out to UAMS. Right.
We did for UAMS.
Well, I meant
Yeah.
she needed to get flown out. She didn't, but we ended up taking her to UAMS because due to the tumor and the size, nobody else would touch it. They were the only ones that would accept it. Went in and had surgery for it. So even with that, that was kind of an unusual type seizure for me to run into that ended up being related to a tumor. And when you think about injuries, any head injury can cause seizures. Your strokes, they can have seizures from the pressure on the brain. Okay, your injuries from a head trauma causes pressure on the brain. Any of those can induce seizures. And then you've got the infection factor. Infection could cause seizures. A lot of times we'll see seizures in children that are febrile seizures. You see that a lot. You'll see it in some older people, but mainly it's in children where we'll see seizures caused by that. And with that type of seizure, you know, you need to try to cool them down with tempered water, get their temperature levels down, and bring them in. If you can get their temperatures down, they'll stop having seizures. The generalized seizures that start in childhood are most likely involved in genetic factors. A lot of them, it's not a single gene mutation. It's very rare, about 2%. More often, it's with multiple gene and plus environment factors are responsible for a lot of that. There is, you've got your genes and your receptors. You've got the GABA receptors and the ion channels. Examples of the genes with the GABA receptor and ion channels, your genetic disorders. They can also have seizures, develop seizures with it. Or your Downs, your Dravet, your Angelman, all of them type of genetic diseases can cause seizures. So that's another factor to look at. Your diagnosis with seizures, you've got your symptoms you want to look for. You've got your medical exam. You want to get an EEG. With your EEG, you're looking at abnormal brain waves. The EEG may help differentiate between a partial and generalized seizures because, you know, partial is limited, a limited seizure in the brain. When you got to generalize, all of the neurons are firing and overstimulating. And then you've got the genetic testing. The treatments for that is usually the treatments for seizures can be medication. It can be diet therapy. And with the diet therapy, they're recommending ketogenic diets. And their thought is it has proven to reduce seizures in children on the ketogenic diets. They're using the fat for the energy instead of carbohydrates. And it has shown with children to help reduce their seizures. Well, and those are tried on usually children that are unresponsive to medications. that's the secondary line to go to.
There's certain ones that certain types of fats actually helps their brain. And my cousin was one who had epilepsy when he was a kid. But what they had to do is they had to go to olive oils and natural butters and things like that. He eventually, after it, the other fats and stuff were not adequate for intake for him to have the proper fats and stuff for the brain to function properly.
And then the other thing that they have done for treatments on it is your nerve stimulation therapy, which is a planted device under the skin that is programmed to stimulate the vagus nerve. And when it does that, it works as a pacemaker for the brain, which is very interesting. And it looks like, to me, when they embedded it, the picture they showed was under like it would be a normal pacemaker, and then it feeds up into the vagus nerve and stimulates it. So it's basically a pacemaker for the brain, which
control alt delete.
yeah, and I was unfamiliar with that.
Wow.
That's something I learned, so I thought it was pretty interesting.
It's interesting.
And the other one that they do, and it's more rare, is surgery, because they've got to make sure if they can go in there and take out the part of the brain that's causing the seizure, it's got to be a part of the brain that really doesn't have as much use. Otherwise, they don't do that usually. But they will go in at times and actually surgically remove the area of the brain that's causing the seizures, the neurons to overstimulate and fire. But that's more rare. There's different medications they give for seizures that some of them are really familiar with. You know, you've got the phenobarbital, you've got the clozapam, there's just the lactol, there's just a different host of medications that we run into with seizure patients. And a lot of them, with the seizures, they can check their levels of their medication to kind of regulate whether it's working, because here they had a seizure, so we need to check what their levels are. For people that have a new onset of seizures, you just got to be more aware that you need to try to figure out if it's due to trauma. You need to try to figure out what caused the seizure or may have led up to it, you know, and then, because then they're going to have the CT to see if there's anything going on. It may or may not show anything at that point, because they can cause real damage. But you just got to kind of think about, like with her, she didn't have a history, but she had some on presentation prior to, right? Even though we knew she had a generalized seizure because she had almost everything. She wasn't post-ictal, which was really weird, but she had lost consciousness, and she had been having presentation of being altered and falling, which all come from the pressure on her brain. So those are really interesting. The videos I wanted to show is a lot of us, we see the outer effects. These are videos on the brain, which shows some interesting things. And one of them is an autopsy type that they're going to be showing. So we'll go through the two videos.